Welcome to the 8-part learning series of the Utah School Mental Health Collaborative. Thank you for everyone who is here. So we have our usual team from the UTech lab that houses the Utah School Mental Health Collaborative and also participates in the 8-part series. We are a technology in training, education, and consultation lab housed within the College of Education. So let's take a minute to go around and introduce ourselves, and then we can go ahead and get started. So my name is Dr. Shatriala Prima Wood, and I am the postdoctoral fellow in the UTech lab.
Hello, I am Derek Smith, and I am the staff psychologist for the UTech lab.
I am Jocelyn Kazer-Kodama, and I am the project development assistant for the lab.
Wonderful. Thank you all for being here. So first, we want to give a big shout out to the organizations and institutions. Some of this work would not have been possible without the support from our funders and collaborators. Cambia, Huntsman Mental Health Institute, ULEAD, and Utah State University. The content for today's training was developed by the Mental Health Technology Transfer Center Network, also called MHTTC, and the National Center for School Mental Health. The MHTTC network hosted an 8-part series using the National School Mental Health Best Practices implementation guidance for implementation guidance modules for states, districts, and schools. This resource was developed by MHTTC network in partnership with the National Center for School Mental Health. And what this really does is it aims to help states, districts, and schools really advance the comprehensive school mental health and engage in a planning process for the implementation of their work. So the primary intended audience for this series includes districts, school teams, and community behavioral health providers who develop and oversee school mental health systems, class-wide, could be building-wide, and also school-wide. So the guidance modules includes a trainer manual and a participant manual. There's 8 sets of slide decks for each module in the implementation guidance. And it also talks about all of the core features of what a comprehensive school mental health system should look like. So if you are interested in accessing the curriculum, I am going to drop a link in the chat at the end of this presentation. So if you are interested, go ahead and fill that form, and that way you can have access to this guide. Okay. So here you can see there are 8 modules that make up the implementation guide. And we have so far covered foundations of comprehensive school mental health, teaming, and today we will cover needs assessment and resource mapping. So if you did not have a chance to attend all of those 2 previous sessions, you can find the recording to it in the UTech Lab website. And again, all of those links will be sent to you if you have registered for this today's session. All right, so while we do cover needs assessment and resource mapping today, every first Wednesday of every single month, we will continue to host these sessions, and every month we will cover each individual topic. All right. So before we get started, a really quick disclaimer. The opinions expressed in this learning session are the views of the presenters and by any means do not reflect the official position of the Department of Health and Human Services or SAMHSA, the MHTTC network, and the National Center for School Mental Health. No official support or endorsement of the HHS, SAMHSA, or opinions described in this document is intended or should be inferred. So for a few minutes, I'm going to share some of the highlights from this module as a refresher, but we do want to remind you that the full module recording is available and can be accessed through the flyer that you may have received. All right, so let's move on. So before we dig deeper into, our topic today, which is needs assessment and resource mapping, I just wanted to kind of like give you an overall about, what these two words or processes mean. So let's first understand what a needs assessment and resource mapping are and what they look like in the schools. So a needs assessment is a collaborative process, and this could be set up by a system. So within a school, within a district, or an external agent that works closely with a school district. And the purpose of a needs assessment is to identify any strengths, gaps, clarify priorities, inform quality improvement, and also advance any existing action planning. A needs assessment must be a collaborative process. I cannot stress more. We don't want to do this work in a silo. We have to bring all folks who are involved with the schools together, because that really helps to integrate data from all over and, includes the perspective of a wide range of individuals. And, those individuals don't necessarily have to be a part of, are not only a part of the system, but those individuals are also impacted by the system. So think about families, think about students. So some key features of a needs assessment, once again, includes identifying gaps and identifying strengths, but also doing that collaboratively. So why are needs assessments so important in the schools? And, thinking about the previous two modules that we have covered, school mental health is kind of more of a personalized and targeted service. And those services really are intended to meet the very, very unique needs of a school or a district. We have diverse students and families, so everyone's needs are different. So what is valued and works for one community may not essentially work for another community. So a needs assessment can really help a school team decide the best services and the best supports that are really fitted to those individual needs. Now, needs assessment can also inform a team how existing resources that they have are meeting a student's mental health needs. It can also help a school identify their most pressing mental health concerns and needs. So for example, a school whose biggest concern is academic stress and anxiety will most likely benefit from different services and supports, say compared to a school whose main concerns are trauma and depression. So that's kind of where you have to identify the unique needs. So understanding the strengths can also help the school mental health teams to figure out how to use their strengths and to help address gaps, inform potential action planning, and effective resource allocation. Okay, so that was a needs assessment. Now, what is a resource map? A resource map is a dynamic and active process. And what it does, it identifies, visually represents, and shares information about various supports that exist within a school, but also outside a school. So think about community. So all of the resource map will really inform how to effectively use a school's existing resources or assets, and I'll talk more about that. So sometimes a resource map is referred to as what we call an asset map or kind of an environmental scan. So think about scanning what's available in your environment. And this is a map that shows the allocation and types of services that are available to everyone in the school. So it can also be a map or a guide, almost like a directory that lists services and resources. And creating a resource map is actually an ongoing and active process because you will have to frequently update this. Some resources, increase, are created as you go. Some resources, you may feel that, you need to take a step back and maybe they're not the best fit for you or your school. So in that sense, this resource map directory, asset map always has to go frequent edits and updates. So again, just like why is a needs assessment important? Why is a resource map important? And this is a really important question. So it is common, for schools and school districts to not have strategically met or have a clear list of, the wide area of services available to their families and their students. And this is not necessarily that there aren't resources. It could be for other reasons, such as everyone is so busy with their roles that, they haven't really come up as a team, sat down and made a list of all of these. So it's important that school mental health teams, take the time to share resources that they as individuals may be aware of, that other people may not be aware of. So for example, if I as a school psychologist, I may know of 5 resources that are available, and then the school counselor may know another 5 that are available that I was not previously aware of. So if we come together as a team, we're kind of able to discuss and lay out those resources and organize them as needed. So often the decision to seek out or use a given resource kind of stems from a particular funding stream. So, or it could be a mandate, or it could be, something has come up, and as a result, we are reacting to a particular incident. So now we have this resource. And those are often the common themes that we see, how people will, come up with resources. But I think for a comprehensive and systematic mental health system in the school, we need to think about how we can strategically do this and do it as a more proactive approach. So by updating a resource map and finding a system to frequently keep that document up to date, schools are actually doing a service to their families and their students. They're improving awareness. They're teaching families and students how to access these services. And they're able to find different services that fit the different needs and the different populations that the school serves. So this is something to think about. And also a resource map will really help schools and communities better connect with each other. They will help families and students connect with community resources, and that by then increases collaboration. So we spoke about, the definitions and why we need a needs assessment, and we did the same thing for a resource map. And now it's important to think about how does a needs assessment and resource map kind of go hand in hand, right? So again, to recap, a needs assessment is really taking a snapshot of your system, understanding where the school's needs are, but doing so systematically. And this is going to help clarify your priorities and where you need to spend the time, effort, and the funding that the school or school district has. So it does not always have to be about what we don't have. It can also be about what are these existing things that we have, and what do we want to do, how differently do we want to organize or arrange those. So that's a needs assessment. And a resource map is going to tell you, okay, now we have these needs and we have these existing resources. How are we either going to manage them differently, or how are we going to make these needs that aren't met, and what do we need to get there? So you need both of them, because it's almost like one is incomplete without the other. All right, so I am going to pause here a little bit, and this slide, I'm just going to give you a couple of seconds to read through. And this really summarizes the purposes of a needs assessment and resource map. All right, so it will assess student mental health needs. And like I mentioned before, it will also assess strengths. And by using the needs assessment data, we can select, plan, and implement services and supports as indicated. And then we come up with a resource map. And through that, we identify services and supports that are already available, could be within the school, could be within the district, could be within the community. So it's really up to you how you want to kind of categorize that. And then with those available resources, you select, plan, and implement services and supports. And when you combine those, you can really align what the existing needs are with the existing services and supports. So I know we spoke more about the purpose and what those processes really mean. So here, I just wanted to drop these helpful tips when discussing with your team about needs assessment topics. So here you see a range of topics that can be considered and included when you as a school are thinking to conduct a needs assessment. So this is where kind of your mental health team comes together to help identify topics of great interest that will really increase the likelihood that information is gathered, and those that is gathered is relevant and can help inform the improvement of your school mental health system. So while these are some topics, some examples of questions that can be included in a needs assessment are: what are the two greatest stresses that's faced by students in your school, again, building or school district? So another question is, if you need counseling services, where do students, or where would you go for help? Would you recommend the existing and available mental health resources to another student? If you have used mental health services in the schools before, how satisfied were you with those services? So that is a question where you do have these services, but what are some areas for improvement? And what things would you recommend to improve the current services and supports available to students? So that's where kind of the feedback and the recommendations come in. So that was really a brief snapshot of the whole module, the recording. If you have not had a chance, I would recommend going through it. So I just wanted to give a brief snapshot before we moved on to the discussion questions. So our first discussion question is, to what extent does your school district best use, school or school district best use, sorry, school or school district use best practices to assess student mental health needs? And think about, some of the information that we have discussed. And if you feel your school or school district does not do a mental health needs assessment, does it, but maybe not so comprehensively. We did that in the past, but we're not doing that anymore. These are all things that we can bring to the table and expand upon. But after that, I will kind of follow up with some best practices.
The things I noticed is that a lot of these topics go hand in hand. So as you brought up, like some of the things we talked about previously around teaming and those kinds of things. And I noticed that one of the upcoming discussions will be on screening and kind of how do we identify some of these needs? And those things are going to be part of that process, is knowing what our stakeholders in the schools, what they're noticing, and making sure we're bringing together a group of people who are able to have those different viewpoints. And for folks who have smaller teams, I notice that's a little bit more difficult. It's like, okay, it's just me. Maybe I'm the principal, I'm the school counselor, I'm one siloed individual within maybe a smaller school or even a larger school system, trying to figure all of this out. I'm like, well, who do I talk to? What do I do? And so I see that as being an area where this really fits in, is being able to connect to that teaming part of it, like bring that team together and make sure we're identifying those stakeholders and then having this discussion in that group, but also noting that we're also going to be able to identify some of these things through screening, which we'll talk about next month.
Thanks for sharing that, Derek. I 100% agree. And this kind of goes back to something that I mentioned, that we need to be proactive, and it's almost like a step by step. So if you identify, your needs, you're one step ahead before you do your screening. And there are some schools. So again, there's no, I guess, right way to do it, but how do you want to best use your time, effort, and energy, and your funding? And these are some things that that are helpful to think about. So thanks for sharing that, Derek. So I just wanted to share some best practices. And Derek, you can see probably some things that you have mentioned are listed here. So we definitely do want to convene a diverse needs assessment team. So going back, this could essentially be your school mental health team. And then if you do recall, we want a diverse team. So that could include admin, that could include educators, that could include community mental health, behavior specialists. It can include your parents, it can include your students. So when we have all of these people who come to the table, we are much richer because everyone knows more, and you don't have to work really in a silo. The next one is review existing data. So think about the school data, such as suspensions, attendance, truancy records. And like Derek mentioned, if you collect all of this data at this stage, when it comes to screening, you are much more prepared to assess and analyze those results, and those will likely make more sense to you. And in that way will help make you, will actually help you serve your students better. The next one is, so use your needs assessment tools and processes that are psychometrically sound and culturally relevant. So we cannot stress this enough. We have to identify what our school population is, and we have to pick our tools very carefully. One reason is we want to be inclusive. The other reason is your results won't be valid or reliable if at all you don't pick the right tools. And again, all of the effort that goes into conducting a needs assessment will probably not reap its results really, or its benefits. Okay. The next one is pilot your needs assessment with a smaller group of students, families, and other relevant groups to obtain feedback. Just like, and we will talk about this next month, just like screening, if this is something that you're doing for the first time, it's okay to do it with a small group. And that way it also helps you to, reassess, revisit, and do things a little bit differently. It also probably will make you less overwhelmed, and will continue to motivate you to do this kind of needs assessment frequently. And focus data collection on determining the pressing needs impacting students at all the tiers. So think about the multi-tiered system of support. You have groups of students across these tiers, and students in every group will have different needs. So if you're thinking, how do we categorize these? How do we identify different levels? That's some place that you can start. And again, if you want to do it small scale, you can go grade by grade and focus on all of the students who are tier 1. So pretty much all of your students in the school are going to fall under tier 1. So these are like different ways that you can categorize, and really think about these tips when you sit as a school mental health team to plan for the needs assessment. Okay. So the second question is, to what extent does your school or your school district use best practices to use the needs assessment to inform decisions about selecting, planning, and implementing appropriate services and supports? So this is the phase where after you have conducted your needs assessment, how do you use that data to now identify the services and supports that need to be delivered?
Well, I'll jump in again. I think for me, one of the things that I notice with schools that I work with is that some folks are earlier on in the process. Some haven't gotten to this point. And I think what's important about this is that it's not just what extent do we use these practices, or it's also what is our intentionality of using these practices. So knowing and learning about these things as we're talking about them here, I think this is a really good opportunity for folks to be looking at that future piece as well. So it's like, I may be at the needs assessment stage right now, and maybe I'm even teaming, just kind of getting those people together, and I'm moving to that needs assessment stage. But knowing that as I'm developing that, as I'm moving forward along that process, I'm picking those things and I'm looking at these best practices and saying, okay, this is what we're going to do. And for those who are doing that, it may also inform how we're doing our needs assessments. It's like, I need to know how I'm going to implement it. So I'm also going to be focusing my needs assessment in that way as well.
Yeah, thanks for sharing that, Derek. I 100% agree. And for some schools, this may be something, that they have previously heard of. So it takes a lot of effort to kind of like lay out a plan before you implement. So that is also a good place to be in. So it's maybe not all schools necessarily are at this phase where they have collected the data, but like they're a step right before that where we're preparing to implement.
It makes me think too about not just with the teams that we're a part of, but also just being on site in a school and having touch points with students. And yeah, I'm not sure your perspectives on that piece of like informal assessments through what we notice and see in school culture and student dynamics, and also feedback from students. But it seems to be that would be another part of this assessment process before decision making about what supports to put in place.
Yeah, thank you for sharing that, Eric. I agree. And yeah, because we can talk all about how to do and what to do and when to do, but I think like when you're actually there in person, maybe the order is different. And like you mentioned, creating touch points with students and talking about them to understand their needs before you decide what do you need. I need to know why you need it. So it kind of like digs a little deeper. So thank you for sharing that. And in the next slide, I will again provide some best practices for schools who feel that they are in a place where they may have done like a small scale or very brief needs assessment. Again, if you're starting these things off, it doesn't have to be perfect. It's like every step is a learning process, and with every step you make it better. And with your teams, the more diverse their teams, the more input that people will bring in. So here are some very brief best practices. So for schools who have, completed that phase of a needs assessment and now have that data, develop an accessible comprehensive needs assessment report to inform the decision. So it's just like, if you're doing an intervention, you collect your data. Now you need to organize your data to best identify how the students are progressing. So similarly, once you have your data for your needs assessment, create like an assessment report, categorize the data however you feel it makes the most sense to your school and your teams. And then come together as a team to go through all of those results, to review those. And also this is a good time to reflect back on how things went with your needs assessment. What are some things that, went well? What are some things that you all as a team feel things could be done differently? What are some things you want to continue? So another best practice includes use data to inform how gaps can be addressed with available or new resources and supports. So like I mentioned before, it doesn't always have to be about what we don't have. it can also be about what do we have and how do we rearrange or restructure these to benefit more students or to improve what we have. So there are so many angles that you can really assess your existing resources and reorganize them. The next one is use the needs assessment data to prioritize what selections and strategies best meet the needs of your school. So again, there may be so many needs that come up as a result of this needs assessment. So while it's all of our intentions to address all of these needs, sometimes that may not be the most feasible way to go. So in that case, if you do have to make a decision, prioritize what are the most pressing needs, and prioritize if you want to do that within a school building or within a school district. So again, you have to kind of sit as a team and decide the way that is best supported for your school. So I want to pause here for reflection. So hypothetically, if you have not, if you're a school that has not conducted a needs assessment, or you are a school who has conducted a needs assessment, but for this purpose, if you were to conduct a needs assessment in your school or your district, what would that look like? And when you are at that stage of contemplating, here are some questions to kind of get you all started. Or if you're a school who wants to do things differently, these are also some questions that can get you thinking. So who would you want input from? Again, who do you want in your needs assessment team? Who do you want people joining this work? What are you most interested in learning from the needs assessment? For example, are you interested in learning what needs are not met? Or are you interested in learning how to improve existing resources to kind of fit the needs? What questions would you like to see included on the assessment? So again, as a team, what are some things that you want to know about your school, about your families and what they're experiencing? What strengths would you consider assessing? So again, it's not about what you don't have, it's also about what you have, which are strengths. So if you want to ask questions about how students and families feel about what's already in place, this would be a good time to check in on that. How would you use the information you learn from the assessment to improve your school mental health system? So again, next month we'll talk about screening. So before you screen, you need to have strategies in place to triage and to provide those necessary immediate supports. So similarly, when you plan for your needs assessment, think 10 steps ahead and think about the question. Once you have this information, how do you want to improve? What are you envisioning? What are some immediate supports that you feel like you will have to have? Okay. So the next discussion question. To what extent does your school or your school district use best practices to conduct resource mapping to have access to an updated resource map or guide to identify existing school and community mental health services and supports? So previous discussion questions were about needs assessment, and we're switching gears to a resource map. So take a minute to think about it. And again, if the schools that you work with or that you work in are not in this phase yet, that's completely okay. If you're starting to think about it, that's a very good place to start. So you may not know the answer to this question, but it's also always good to think ahead. And, hypothetically, if you are to conduct a resource map, how would you kind of
One of the things that comes to mind for me is kind of tying it into the teaming, those pieces. And even on your last slide, you were talking about, who are the people I'd want to hear from when I'm doing this process and going through that. And I think one of the parts about doing a resources map, as you brought up at the very beginning, is knowing what people do, knowing who these resources are in the school. And I've noticed limitations in some schools where they don't know. You brought up school psychologists. Well, I'm a school psychologist and I have certain resources that I know about, and the school counselor knows certain resources that they know about. But there may be a teacher that doesn't know what the school psychologist does or what the school counselor does, or there may be some people that are part of this team who don't know what these varying roles do. And I think that's an important part of this process, is being able to just start off knowing, like, okay, what do we all do in this team? And then be able to know, okay, so if I have a behavioral issue or something like that, I might be looking at the school psychologist and, how they can bring in some behavior planning and that kind of thing. And, or if I need maybe some basic mental health supports or connections and things like that, maybe I direct towards a school counselor, and kind of, and that both do that in different kinds of ways. School psychologists can do some of the mental health supports, but it's kind of a different process. And so I think that's a really good starting point, is knowing like what we do in our team, and then being able to say like, oh, well, I know that, so maybe they have resources in this area too, as we're expanding out in this mapping. And then the last thing with that, also knowing, I think we talked about this with teaming, those individuals in the school who really play a part in this that we don't think about right away. Like I think we talked about custodial services and front desk folks, secretaries, people like that, who really do play a huge part in the mental health of our school by listening, by talking to students, by doing all these things that we don't necessarily just immediately connect as like, oh, that's a mental health support in the school.
Thanks for sharing that, Derek. Yeah, I mean, I cannot emphasize your point more. And I think the more people we bring to the table, the more comprehensive our resource map is going to be. And I think that's a good way to think about the service you do to your students and your families. And, not intentionally, but, the more people we have, the more options that our families have. And think about, again, our students and families come from diverse communities. So like you mentioned, Derek, if you have a secretary, who may be African American, for example, that will be, and majority of your school staff identify as white. So that would be like a really, really good place for you to bring in that person, again, for a diverse perspective. And you probably do have African American students in your school. So again, how do you be equitable? How do you be inclusive in the work that you do?
And to build on that, something that it made me think of is to not recreate the wheel. And notice in this question, you have to have access to an updated resource map. And so first asking the questions of what resource maps have we put in place, even if basic? And then how can we update them and perhaps put someone in charge to have a lead for maintaining that resource map, because it's a continuously evolving map, ideally. I mean, there's always new providers and resources and partners, and then sourcing feedback from the community on how to make it more useful and relevant, and just have more utility in practice. So that was a piece that came to mind as I was listening to you and Derek speak.
Yeah, thank you for sharing that, Eric. And I agree. Yes, I think having some sort of organization around who wants to, almost like how do we effectively delegate? Because again, you cannot do this work alone. And we're talking about a comprehensive mental health system. So at some point, organization and delegation within your own teams will kind of enable success continuously and routinely. So yeah, some important questions to think about, like Eric, you mentioned, would be how frequently do we update this? Who updates this? And kind of, I guess, almost like a system to identify, as new resources come up in your community, what are some ways that we can identify those so that, we are aware of those things and that, we try to, again, best serve our students and families. So, and I think Eric and Derek both of probably some of the things that you both mentioned are actually best practices. So, use multiple sources to identify resources already available to students and their families. And this is kind of where you have to include more community organizations and community mental health supports. Even like parents, there may be parents who are, mental health advocates, and they may know more. They may, interact with those individuals. So again, kind of goes back to who do you want in your mental health teams? Create and foster school community partnerships to ensure ongoing communication about, again, programs, services, and new organizations available to students and their families. Develop a user-friendly, updated, and comprehensive resource map or guide that includes data about each resource. So think about the name of the resource, so name of the program, name of the organization, a brief description of the services provided, the website, the address, the phone numbers, hours of service, and all those other pertinent information. Ensure a resource map is accessible to diverse stakeholder groups so that they can use that information. So again, you want to disseminate this widely and also frequently update the resource map. So this is kind of what we spoke about. How do you want to organize or categorize your needs assessment and your resources? So just like categorizing mental and behavioral health needs of students in the schools, resources can also be categorized across the tier system of supports. So, such that specific resources are assigned to each tier, and we are being very intentional about how those supports are made not only available, but distributed and accessed. So again, if you're thinking where to start, how do you organize? This is a tip that we wanted to provide, so that can kind of help you feel less overwhelmed. Okay, so just wanted to bring this slide in for reflection. What services and resources will be mapped? So we talk about resource mapping, services and supports, but a very basic fundamental question is, what services and supports do you want as a school team to map? So some considerations includes, do you want, again, this depends on the size of your team and the capacity, and and also your intentions. So, but you can always start small, and that's a good place to start. So think about, do you want to do this within your school building? So do you want to map resources that are available within your school building, or do you want to go big, go all the way to your community? And again, this depends on how big, diverse your team is, and also the capacity of your team. What are some inclusion criteria? So again, do you want resources in your neighborhood? Do you want resources in your community, in your district, throughout the state, or national resources? So think about, national mental health organizations. What's the proximity of these resources? Do you want it, again, if you're thinking about neighborhood and community, do you want it within 5 miles of your school? Do you want it within 10 miles? So again, it's important to think about, your existing student population and their families, and what resources they have. And resources across the three full tier, the tier that I showed in the previous slide. So do you want to start off at tier 3? Do you want to, do tier 2? Or do you want to do tier 1 and, cater to all of the students in the school? So again, there's so many things to think about, but again, if you are a school or a school team that is interested in this idea, you can always start small. And that way, you start small, you pilot it out, and then you can always reassess and keep growing. Okay. So this is our last discussion question. To what extent does your school or your school district use best practices to use an updated resource map or guide to inform decisions about selecting, planning, and implementing appropriate services and supports? And I just wanted to, for the sake of time, and I do want to share an example of a resource map. So I wanted to share this best practices. So like I mentioned before, like your needs assessment and your resource map kind of go hand in hand. So you can pair your needs assessment data with your resource map that you have to consider these are our needs and these are our resources, and with what we have and what we need, how can we find like a happy medium? And also just having both of those, like the needs assessment data and an updated resource map, you can really like reduce, or so if you feel, so for example, last month you created a resource map and then you update it monthly. So the following month you all sit together as a team and you hear one of these resources in your map is short-staffed. They may be closing down in the future. So a question would be, do we want to continue having that support or listing that support in our resource map? Or you hear about the quality of services provided by a community organization. So a question is, do you still want to continue having that resource on your resource map? So these are some questions to think about as you update a resource map. And identify areas of need not adequately addressed and consider how to address those unmet needs. So, again, like we mentioned before, you have your needs assessment data and you continue to prioritize. So as you update your resource map, you can go down the list of your needs assessment. And, so that could be like a goal for your mental health team or your needs assessment team is every month we find out, we find a resource to meet the next need on our needs assessment list. So there are different ways that, you can tackle this. These are just some best practices, but again, it really depends on your capacity, your effort, and how big really your team is, but it's always good to start small. So this is actually an example of a resource map. So this resource, the roles of school-based mental health professionals, was developed by the National Center for School Mental Health. It really highlights the availability, contact information, and the unique roles of each service provider. So this is kind of what this actually adds to what I spoke before. You can include their contact information, their hours of service. So here you see availability, email addresses. Not everyone uses email, so maybe including a phone number, just to make it, again, very accessible to our families. So this is an example from a pre-K through 8th grade school in an urban district in the Mid-Atlantic. So what their school mental health team did was they worked collaboratively to put together this as a service to their students and families. And that way they're really increasing communication about who these providers serve, who to contact, when to contact. So just trying to be very intentional about you have these resources and you're making a resource map, but how do you like really make it work for our families? So trying to make this resource map as comprehensive as possible really helps clarify all and everyone's roles internally. So this is something that can also be distributed widely across the school. So this is something that teachers can print out and send home with their students to their families. Distribute copies of this during parent-teacher conference, have a copy of this out on the bulletin boards of the school, have a copy of this on the school's website. So thinking about really how do we like put out this information that we have found.
Can I say something real quick about that? One thing that I think about with this, and especially if you're putting it out like on a bulletin board or something like that, if you have the capacity, maybe throw a picture on there of some of these folks too, so that when they're walking around the school, when they're, when you're looking for this individual, kind of what they look like, and it can be a little bit more inviting that way and supportive.
That is an excellent point that you made, Derek. I 100% agree, especially if, if these resources are about people who work internally within the school. And also if there are community providers, including like the logo, because sometimes the logo is very familiar to us that we might see as we like drive by. So yeah, thanks for contributing that. That was a really good point. All right, so with that, that kind of closes our module 3, 8-part learning of the 8-part learning series, needs assessment and resource map. This is actually the last series for the year 2021. Next month, when we come back, we will host our screening module, and that will be hosted that first week that we start. If you're a school provider, that first week that we start school. So we will see you on Wednesday, the 5th of January from 9 a.m. to 10 a.m. We will be sending you all reminders and also the link to register for that webinar if you're interested. But thank you all for attending. We will follow up with the recording for this webinar and all of the resources that I listed. We will send those your way. So thank you for joining us, and you have a great rest of the day and the month. Today is the 1st of December. See you all.